Magic 89.9.
Good evening, everyone. Welcome to another edition of Healthline. I'm your tita of the airwaves. My name is Tina Ryan. And with me is my dashing co-host, whose voice is back.
Yes, my voice is back. Doc Rylan here at Healthline.
For those of you who were watching us earlier on playback, he forgot that the camera was on already. So I'm sure a few of you caught him dancing because his daughter did, and Bella's just dying. Hi, Bella. Hope you guys enjoyed the music sweep that we gave you for like an hour and 8 minutes. So tonight,
Yes, tonight.
it's gonna be fun. I have questions already from my social
right?
media
I saw the
accounts
list.
for you,
I saw the list.
for you, not me. And then tonight, also, our second hour here on Healthline, we have, of course, Doc Manny Calayan in the house.
We're going to be talking about beauty.
Beauty and whatnot. You know, I used to be under Calayan. I used to be Calayan baby.
See?
Pre-pandemic. Yeah. So, but yeah, please join us if you have any health questions, health-related questions. I've got a doctor here. Trust him. He is a doctor.
I know, right?
863-10899 or the Viber line is
0945-971-4011.
and it's just funny how I was in a dilemma earlier about the name of a name. It's the name of
By
the
Yuki,
artist
right?
by Yuki, and Doc Rylan comes to the rescue.
She's from G Idol.
I was like, I don't even know how to pronounce this. There's a parentheses
With
and
a
then
G
a dash
and
with
an
a
ID,
G.
whatever.
Thank you, Doc Rylan.
You're very welcome.
We are the home of today's best music. So if there's anything you want to hear, as long as they're on the playlist,
Yep. We're going to give it to you.
do let us know. And on our socials, we'll give it to you later. But I do have a lot of questions already lined up for our good doctor here. Again, this is Healthline.
Magic 89.9.
Today's best music, Magic 89.9. Lotto, it's somebody at 6:20 here on Healthline. You got Tina Ryan and Doc Rylan Flores, who happens to be an orthopedic surgeon and a DNA profiler.
That's just carpentry 101.
Carpentry 101. You on the way. Okay, so he was panicking because he thought he was going to be late, but you were you made it in
Right
time.
in time.
And you said traffic was bad.
Traffic
Maybe because
was, because currently it's still really, really, really bad.
malakas ba yung ulan? Kasi
Earlier.
Okay, it
right now in
stopped.
front of us, it's not so much anymore. It's just like drizzling. But
Okay.
earlier on, rain was terrible.
But it's officially rainy season. So
It's officially rainy season.
let's talk about diseases that we might that's very
Common around this time of the
with
year.
leptospirosis. And how do we get that, Doc? How do we prevent?
Well, okay, leptospirosis. It's actually a disease caused by a bacteria, it's leptospira, and we actually get this from rats more often than not. I mean, like,
I was told as well.
What about rats? I mean, what does rats have to do with it?
Yeah.
The thing is, it's not like having a pet rat or something. You're not like the Teenage Mutant Ninja Turtle. But the thing is, rats are everywhere. The environment isn't clean. And literally, they actually get this bacteria first.
Yes.
And eventually, it passes out. It passes out through the urine of rats.
Yes.
And then, unfortunately, they just happen to be, peeing anywhere. and
Everywhere.
I mean, they don't have like toilets for rats.
Yeah.
Right? So eventually, the bacteria goes around. So when we now go through flood water,
Which,
exactly.
don't tell me Ginawa ko yun, Doc, nung bata ako. Lumungoy ako sa baha.
Let's face it. At one point in time, we probably not just walked across a floody part of whatever.
Yeah.
We actually swam in it.
Yeah. I didn't have an iPad growing up, so.
I know. But anyway, so the bacteria gets mixed with water.
Yeah.
But it doesn't necessarily mean that if you just cross flood, you actually will get leptospirosis. So it actually passes through cracks, nooks, and crannies. And specifically, if you have a wound it's the easiest way for it to
Ayun,
enter. So
oo.
if you have a wound in the foot, whether it be an actual laceration, a sore, or even an ingrown toenail. I mean,
Yeah,
usually,
kasi
right?
they usually say, oh, magbasain, diba? Okay.
So the problem now is it gets into your body and then you get signs and symptoms. Unfortunately, these signs and symptoms could be as simple first as probably the flu or any other disease entities. You get fever, you get soreness of your body, you feel weak, but the eventuality when it becomes worse affects now your liver. So you actually turn a little yellowish.
With leptos? My good, untreated?
Worst case scenario, because the
Wow.
liver gets big.
Oh,
It's
my.
hepatomegaly. So these are the worst conditions.
Yeah.
But that's the reason why we try to avoid crossing floods. But sometimes, in Metro Manila,
You can't.
there are occasions that you simply cannot not go through it. So make sure that one, you don't have any wounds. Hopefully you're wearing good footwear like those boots and stuff.
Okay.
That's pursuing
like
if you-
protection for your feet. In case.
Just so as you really don't get through flood water.
yeah. Okay.
Hopefully.
Okay.
But if you do get through that, you can seek advice to your doctor. They do give prophylactic antibiotics so that you literally, hopefully, won't get sick even if the bacteria hits you. And it depends on the water. We're just talking about the foot, right? But what if the water is waist
deep.
neck deep, or like, beyond?
Like swimming levels kind of deep.
So,
diba?
and not just wounds, but in all orifices that probably are open that can enter your body. So, well, that's a sad part. But at least there are prophylaxis that can be given. So it's not an automatic thing that just because you waded through flood water that you're automatically going to get leptospirosis. So let's protect ourselves. If you do happen to do that, seek the consult. I mean, go to your doctor and talk to them. Health centers actually have doctors, and they even have the medication more often than not that they can actually even give you outright.
But not all health centers are open after 5. Like,
Yes. Well, okay. So it's the next day.
Yeah.
It's the next day.
So, ito na lang, Doc, no? Why don't we just tell the parents not to let their kids swim in flood
Wait,
water?
we're talking about that's kids, but we're talking about adults as well.
right.
It doesn't pick out any individual. It can happen to anyone and everyone, and even to other animals as well. That goes
also
for pets.
to dogs. Oh my gosh,
That
dogs and
happens-
cats. Oh,
Pets. I know,
very
because
prone.
my mom's dog happened to have that long ago. So I think his vet bill was higher than that of a person.
Don't even talk to me about vet bills right now. But hi to our very own Jada. I think she's on the road now. Hi, Jada.
Oh yeah, speaking of
Says hi.
highs,
Shout out to a
I
bunch of people.
know. I have Dr. Robbie A, Dr. Alberto, he's listening right
Hi,
now.
Doc-
Good friend of mine.
Doc Robbie.
As well as, good friends, Joel and Grace Leva. They're actually with me in the hospital. Joel, we
Hi,
have
guys.
OR.
Thank you so much for tuning in to Healthline 626. And I know also, Doc, that the DOH now is collaborating with schools to establish student councils focused on preventing vaping
Yes.
and tobacco use.
Tobacco use.
Okay, so because we do have a lot. I mean, I know in the U.S. there's a rising case of popcorn lungs among teenagers,
Yes, but,
right?
before we talk about popcorn lung, yeah, and it's popcorn lung, not popcorn you use and eat during a movie or something.
Popcorn lungs. I mean, like it sounds to me like parang pag popcorn, it pops like it makes a
Okay,
sound.
first things first. There really is a strong campaign for smoking or against smoking. So that's the reason why we start them young. That's why it's children, even before they try out. We do have the experimenting age.
Yeah.
They do try out anything and everything.
Yeah.
So we're trying to advise them earlier than that. So, I mean, of all of the disease entities that can be caused by smoking.
Yeah.
Smoking, because of that, vaping actually is now in the picture. It was originally meant as an alternative to smoking because what they say is that the ingredients are not as many and not as bad as smoking.
Like regular cigarettes.
Regular cigarettes would have what? More than 200
tar,
toxins.
mga ganon. Oo.
Everything else.
Yeah.
Which they decreased or removed with vaping, because you get to choose whatever is placed in your vape, whatever you call it. But here's the problem. You still inhale smoke and exhale smoke, and it still passes through your lungs. What happens is when your lung lining gets irritated, the small air sacs, when it gets irritated, the glossiness, smoothness of that lining decreases and is eventually gone. So you get kind of sticky things in the lining. They get to stick together. So air doesn't come in anymore.
So
That
where did
is what popcorn lung is all about. They kind of stick together. So just imagine a balloon. Just imagine a balloon. You're supposed to have air inside a balloon,
Yeah.
right? You blow in air, it goes bigger. You kind of release it, it goes smaller, back and forth. That's what the lung is all about.
But with popcorn,
But if you can imagine that end where you kind of blow the balloon,
yeah.
try putting glue in it.
Okay, so it's like air is can't pass through.
Can't pass through. Doesn't get out, doesn't get in. So it gets stuck. Unfortunately, the bad thing is, it's irreversible.
I was about to ask.
It's irreversible.
No, so
And
what are the
we
long-term
just can't
effects?
see it. Sometimes you'll see it on an x-ray, but the actual diagnosis for popcorn, we can't take a biopsy of it. And we literally see those sticking things.
Ooh.
And it's irreversible. So that's a problem. That's how bad it is. And we've seen more cases of it than the past, probably decade.
So if it's irreversible, what could be the long-term effects? I mean, like lung cancer also?
Not lung cancer is a disease entity on its own.
Okay.
This one's different. So you may not actually have any cancers, but you don't have a functioning lung anymore.
Oh my gosh. So
We only
parang
have 5
hihingalin
lobes.
ka.
We only have 5 lobes. 3 on the right, 2 on the left.
Okay.
And that's because the heart's on the left. So
Oh, good to know. Good to know.
if you take out one lobe after the other, depending on where the problem is or how big the problem is. So you can just imagine the amount of air that your body can just take in.
Okay, so that means your heart will have to compensate for that as well.
Well, the heart in a different aspect because of blood flow, that's a totally different story.
Okay.
But we're just talking about oxygen intake and inflow, rather.
Okay.
Oxygen inflow to the lung. You're supposed to have 5 lobes of your lung. If there's a problem in 1, 2, 3, or 4, worse is, the whole area. So what happens to you now? You won't breathe well. That's why you'll have difficulties of breathing and all of these other shortness of breath and all of the other symptomatology that you can actually have just because you opted to do vaping. That's the reason why the campaign nowadays, it's not just no to smoking, it's no to smoking and vaping.
Thank you, Doc. 6:30 on Healthline. I do have a few questions from JM via Instagram. Nika from Las Piñas also sent me a message, and Bea from Cavite. All for you. Sa akin wala, guys.
But wait. I'd like to say hi again to Noel.
Hi, Noel.
From Motorex. Hi, Noel.
Thank you for listening, you guys. Don't forget, 7 o'clock, we're going to have Doc Manny Kalayan with us. Right now, let's play some more of today's best music. This one goes out to your daughter, Bella. Tate McRae's Revolving Door on Magic 89.9.
Magic 89.9.
That's 6:38 on Healthline. As mentioned earlier, hold on. I've got 3 funny questions for Doc from our listeners. Give me 1 second. Hi to Benny. Benny Quarter is on playback.tv/magic899.
Great. Hi, Benny.
Doc, this is from Lola Remy from QC.
Lola Remy. Hi, Lola.
Totoo po ba na mas prone sa injury pag malamig ang panahon? Yung tuhod daw kasi niya parang alam kung umuulan.
Wow.
Oh my God.
She could be a weather reporter.
I know. We were just talking. Okay. So, I mean, is that even real?
Okay, let's put it this way. Some ask that they do feel pains and strains because of the weather. I mean, especially when it's kind of cold.
I'm thinking if my spondy acts up when it's cold.
Spondylolisthesis.
No, you know what, Doc? Parang sometimes.
Okay, here's the thing. No, here's the thing.
I feel old.
There is. I wouldn't want to comment on that. But let's put it this way. The main purpose of muscles, they're basically there to make us move.
Okay.
I mean, that's why we move.
Okay.
But the second job of the muscle is to technically maintain core body temperature. So, if it's hot, it's the summer, you're in a spa,
Okay.
it's relaxed because
Okay.
heat has to go out. But in cold temperatures, the heat has to remain inside, otherwise you'll shiver and you feel cold.
Okay.
Your muscles now tend to cramp up, trying to keep your core body temperature so that you won't feel cold.
Okay.
It's raining and all of these stuff. So if your muscles are set right, it's okay, you won't feel much. But if they're not, they're relatively weak. I say relatively because you can actually still move, but it's not set right, which means it's relatively weak. So now the tendency of it cramping up is already a strain in itself. That's why you feel things when temperatures get cold. Like for Lola, she actually feels some form of strain because of her core body temperature trying to maintain it, so her muscles kind of cramp up, especially in the thigh and the knee area. That's why when it's kind of raining, she feels it, and she actually can tell because the temperature.
No, I
goes
remember
down.
something something that happened to me. We were in Boracay,
Okay.
and I'm super lamigin, Doc. And
Yeah, I
then-
noticed the air conditioning actually. I mean, if you try to get into my clinic, that one's going to be either an 18, 17, or 16.
I cannot. But yeah, I remember.
We're 20 plus right now.
My muscles started cramping. So what part of the back is this? The traps?
Thoracic.
Thoracic,
Trapezius is
but-
on top. By the neck.
So yeah, nag-cramp up siya because my friends went night swimming, and I'm like, no, I'm for the day. I like the sun.
And it's really cold.
And they dragged me, and then I literally froze in the water because my muscles started cramping.
Cramping, yes. Because
So-
it
And they all
leads
made fun of
to-
me.
Well, ganun talaga barkada eh.
They all made fun of me.
But yeah, it cramped up because it needs to protect you from feeling cold.
Okay.
So the only way they know how is to cramp up. That's why you get cramping muscles. And if you can't relieve that, that's why we use warm compresses to actually relieve stress muscles, cramp muscles, and strain muscles. That's the reason why.
Okay, next question is from Paula from Pasay.
Hi, Paula.
Doc Rylan, how bad is it really to sleep on your stomach? Because I think this is the first time me and Doc Rylan are gonna headbutt. Yeah.
Headbutt.
No, because remember, I was married to a chiropractor, and we had a
Okay.
lot of patients come in with neck problems, and the first thing they would ask is, "Are you a stomach sleeper?" Because
Okay.
isn't.
That's-
But
Go ahead.
I know
Go
it's
ahead.
different. It's
Go
different
ahead.
from
No. Go ahead.
It's different
I will
from your point of view.
I will
Okay.
actually agree with you. Go ahead.
Kasi di ba, Doc, if you're sleeping, let's just say, try walking na nakatagilid yung neck mo for like hours, di ba? So that's what you do when you sleep, and it develops a bad pattern for your spine.
It distorts the normal architecture of your back.
There
and your
you
back
go.
muscles. So that's why I said I will agree with you. At one point in time. But there's a small portion that I not disagree, but I will say it's okay. And when is this? Usually when we advise rest, it's mostly because we want you to go with gravity and not against gravity. What do I mean by that? When you're seated, your back is technically around a meter away from the floor.
Okay.
So you could just imagine the work that your muscles are doing so you keep yourself upright, correct?
Yeah.
You stand up. Your back now is more than a meter from the floor. So what does your group of muscles in the back do? They tend to cramp up more because otherwise
The
you fall to
tensing
the ground.
muscles, yeah, okay.
You fall to the ground, right? When you do lie down, you don't have anything against gravity. You're working with gravity because your back's clearance from the bed is probably just what, an inch?
Yeah.
So for me, if I just want you to stay put in bed so we can relax your muscles and go with gravity, not against it, at least for just in a day, I don't really care if you lie down on your back, your side, your front, left or right, whatever position that would be, simply because the idea and objective is to just make you stay put parallel to gravity and not perpendicular to it.
Okay.
So at one point in time, I will go against it, but most of it I will agree with you.
But ideally,
Okay, I go back. Ideally,
we should be sleeping on our backs.
Exactly.
There you go. Benny Porter, I have a question. My mom is convincing me not to drink cold water anymore because, according to an unreliable source, it will slow down cholesterol burning and it might lead to heart attack. Doc. Okay.
Wait.
Is this ano to?
Okay.
For those of you who just tuned in, it's 6:45 here on Healthline. Doc Rylan is
Okay,
with
so hi,
us.
Benny. First things first, let's not blame cold water or anything cold because, especially in the heat, right? You'd want something cold to soothe and relax. And that's the reason why we also use cold compresses and all the like. Here's the thing. If you do drink cold water, your cholesterol literally isn't so much as in the stomach. By the time it's absorbed, it's literally in your blood vessels and everywhere else.
Okay.
So, if you drink cold water, it's unlike if you, you have hot soup and then your bulalo, and then because it becomes cold,
Yeah.
you see all the things
Nagsisebo.
clumping up. No, that doesn't happen in our body. So it's okay to drink cold water, but it depends on your condition. Like when I had lost my voice a couple of days ago, 3 days to be
Oh, you
exact.
were overworked. You're overworked.
No, nabumbunan ko,
Ay, oo nga pala.
No, but seriously, warm water or warm drinks were actually better. But warm, not too hot nor cold. Why? Because it can still give you problems in the long run. So it's just warm, something that's tolerable and bearable.
There you go. Benny, did you get that? Benny? Okay, thank you so much for taking the time to message us. Bumblebing. Doc, what's your take on chiropractic realignment? I love chiropractic adjustments, Bumblebing. It totally helped me. But I don't know, what's your take? Doc Rylan's got a few chiropractor friends.
We do have chiropractor friends. And what it does, okay, here's the thing. What they actually do when they say realignment, it's not literally like a Lego stack that aligns you. But what they do is they simply release the pressure because of their maneuvers and manipulations. They release the tension and stress in capsules of the joints along the vertebra or your spinal canal, and your muscles become more relaxed as well. So it's okay. But what's not okay is that we oftentimes would just rather, if there's an acute problem, we just want you to rest it out first before we do anything else.
Bumblebing, before Doc Rylan answers that, because she's asking if it's safe. If you go to a licensed one, of course it is.
Yes,
But have you had a patient who came from a chiropractor and look at your face.
No, wait.
No, I mean, because I don't want to say, what is the term I'm looking for? Let's just say the adjustments, the chiropractic adjustments didn't do that patient any good. I mean, parang lumala.
Okay, here's the thing. What most actually would see is mostly on social media, right?
Yeah.
That they have a problem with their neck, with their back, with their lower back, and these treatments are available, and that next thing you see, they do dance and they do Zumba and all of these activities, right?
Yeah.
But that's a general thing. That's the reason why we usually would want to diagnose what your problem is. And like I said, I do have chiropractor friends, and we literally, I want to kind of use it as a complimentary thing, because there are some patients that do need chiropractic maneuvers. I will agree. I will not contest that.
I love chiropractic adjustments. I just wish they weren't so
also-
expensive eh. Mahal ang adjustment to
Sila
ka.
mahal kami. No, but seriously, that was meant as a joke. But seriously, it's complimentary because there are some patients that when they do see them, they'd outright tell that, no, I think you need to see an orthopedic surgeon first before we work on you. So it's more of a complimentary thing.
Nice.
And if and ever, like for me, I'm the orthopedic surgeon, and there happens to be somebody who came from a different chiropractor that I might not know.
Yeah.
They usually have numbers anyway. I do get in touch with them just so as to coordinate so that we can better treat the patient. And it's not just because, this isn't blah, 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 whatever. But the idea is, let's see what's wrong with the patient, what has been done, and what needs to be done. Because for all you know, it just needs a little rest, and then I just bring the patient back to you.
Bumblebing, I hope that answered your question. And as a former chiropractic assistant, I would just like to tell you it's not a one-time thing, okay?
Because you don't move just once. You move every single day.
You don't go in there for your one-time adjustment. No, it has to be like some sort of maintenance na treatment. Okay, my tita is calling. Hi, Tita Ku? Tita Ku, are you watching me right now? Hold on, I'll call you back, Tita Ku. It is 6:50. Here we go. More of today's best music. This time, it's the latest from James Reid.
Magic 89.9.
Totally vibing to this song called MKS, Mahal Kita Sinta. Woo! Why am I kinikilig? Today's best music, Magic 89.9, 703. This is Healthline, your go-to radio show about health on Wednesday nights. And I have with me Doc Rylan Flores, my co-host, who happens to be a badass orthopedic surgeon.
Just put it at that.
Hello once again to Doc
Robbie A.
Robbie, hi Doc
Dr.
Robbie.
Alberto.
It is 7:04 and OMG. I mean, one of the country's leading. I mean, this guy needs no introduction. I mean, cosmetic surgeon to the stars, Doc Manny Kalayan in the house.
Yes, in the house.
Doc Manny, so good to see you.
Yes, for a long time.
But you guys, I was just telling them, I hate that these two are more makinis than me. Hello.
Makinis ka rin naman. Ikaw naman.
Gosh, no.
She always feels
I was-
inferior.
I was bragging to Doc Rylan. I used to be a Kalayan baby. No!
Yeah.
Teka,
And now
ba't
you're
used
coming
to
back.
Kasi, di ba? Wala na yung used to, tatanggalin na lang.
Magpapalagay ako ng ano.
Ano
ng
kaya
bagong
yun?
heart. Doc Man, it's good to see you.
Yes, Tina.
Oh my goodness.
Likewise.
Well,
Grabe.
you are not aging, obviously. I mean, you got to share your
Of course, it's
secret
my
at some
profession.
point. You know, funny. When did we have Doc Derma?
Oh, we had Dr. Ann Vicente.
When was that? Was that
Just
last week?
Just last week.
Oh,
So-
Dermatologist.
Dermatologist.
Okay.
And she
The
only has
skin.
like a four-step regimen. Doc, be honest. What is your skin regimen?
She asks everybody who has good skin.
Like seriously.
No.
I mean, do you
So
have like a
have to tell my
15
secret
step?
ba?
It won't be a
Oh,
secret
secret.
anymore.
No, they have to go to my clinic first.
So that's the secret. That's the
the
secret.
secret.
That's a secret. You're still in the same location.
Same
This is
location.
where again?
In Medical Plaza,
There you
Makati.
go. There
And,
you go.
I also have in Alabang,
Oh, saan sa Alabang?
Festival Mall.
Nice.
Branching out.
Oh, pwede.
For the
Love
mga South people there.
Oh, mga chong,
That's great, that's
mga
great.
chong.
Yeah.
Okay. For those of you just tuned in, again, this is Healthline. Doc Manny Kalayan is with us. If you have any questions, send them our way, 8631-0899, or we're on playback.tv/magic899. I will send you the link, Doc,
All right.
so you can share it to your followers as well. Doc Manny, hormonal breakouts. Let's talk about that. Should I be using anti-aging products already or just focus on acne first? From Jen.
Yeah, you should focus on the acne first. What's your question about the hormonal imbalance?
I'm 24 and I still get hormonal breakouts.
Oh yeah, so it's
Teka,
24.
24.
Yeah, that's still normal age to get.
Kasi ba ang
acne.
hormonal is after 40 ba? Tama? Hindi. I mean, you're the doctor, tell me.
Pre-pubertal hormone yan.
Oh, okay. So, pasok pa siya, obviously.
Yeah, pasok pa
Okay.
siya.
But the height of it usually is the teenage years, right?
Teenage,
Because
from
this is where
18,
it becomes
yeah,
really bad, and
Yeah.
it's trying to fix up a balance because of the growth spurts and
Right.
everything else.
Right. The hormones has to be balanced.
Okay. So, yeah, well, when do we start using anti-aging then?
As
Pag
early
may
as-
wrinkles na.
No, you can prevent it rather than treat it.
How early?
Mga 25, 20, 24, ganun.
24, 25.
They can start from a soap,
Okay.
from a good soap, moisturizing
What's a
soap.
good soap?
You have to go to his... you have to go to his clinic.
No. Honestly, what I use is a moisturizing soap.
Moisturizing
Yeah,
soap.
because it gets rid of the wrinkles, the dry skin.
Okay.
Because the wrinkles come from the having a dry skin.
Yeah, because I never moisturized, and I literally cried, Doc, when I first saw like you, crow's feet. Oh my gosh! Yeah, my sister's like, I told you to
I think
moisturize.
you can do a lot of things for that.
And then, of course, avoid sun exposure.
Yan, sa pa yan.
Yeah, the
Avoid
sun
sun.
exposures. That's the reason why anything and everything now has actually SPF,
SPF.
or
Yeah,
all of
the
these things.
sunblock, SPF. Yeah.
Doc Manny, you've helped so many Filipinos feel confident in their skin. When did this journey in cosmetic surgery start for you?
Well, we started 1997. And then after our training, we put up a very small clinic lang, no? With Doc Pai. And then ayaw pa niya. So she's afraid of not parang it's gonna be a failure daw. So no, let's try it. And then then the Plinky Recto came first.
Oh, she was your very
Yes.
first celebrity endorser.
First, and then sila who's this girl? I forgot na, tagal na kasi. Anyway, yun, and then word of mouth. And then we grew na, the clinic grew, and then we transferred to Medical Plaza na, a bigger one. And then transferred again to a bigger one.
Oh, look at that.
Yes.
Expanding and
And
expanding
then
and
we're
expanding.
tandem eh. So she's a derma, and I'm the butcher.
Pares kayong butcher.
Doc Pai actually is a very good friend because we're together in PAMI.
Yeah.
Philippine Academy
she's
of
so active in
Aesthetic.
PAMI.
She's one of the board members of the board of directors.
Yeah.
So hi, Pai.
Hi, Doc Pai.
Hi also because PAMI is where Dr. Gisela is.
Yes, she's
with
the
Dr.
vice
Charlie
president of
and
PAMI.
Dr. Richard.
That's right.
Right.
We're going to talk about cosmetic surgery myths in a bit, but right now, Ramam? Okay. Some of them have really like difficult handles to pronounce. So, how long do Botox last? And how about under eye fillers? I love Botox and eye fillers. Oh my gosh, I highly recommend you guys if you have like anong tawag doon, Doc, yung
Sunken.
Yun,
Sunken
kasi
eye-
nga as we
under eye,
age,
yeah.
Doc, diba, lumulubog yan.
Yeah.
And mine was really bad. I thought it was eye bags. Hindi siya eye bags kasi nga,
The eye bags is puffy.
yeah.
It's
But this one is
bulging fast.
inverted. This one is like sinking.
It's the kabaliktaran.
Ramam, oh my gosh, you should try fillers. I'm not even kidding. I mean, it's instant, right, Doc?
Instant,
it's instant results, and you're like 10 years off your face. I
Yes,
swear.
Because with sunken eyes, you look like puyat lagi.
Parang, oo.
Yeah, haggard looking.
Yun.
How soon, for instance, if I have like an event and I really would want to look good, how early do I have to do these things? I'm not saying that I'm going to do that, but
Prep time, Doc.
Prep
Prep
time.
time.
Actually, it's a lunchtime procedure.
but how early? Like if I have an event, say on Sunday,
Say,
probably.
Yeah. Say, do it on a Friday.
Oh, that fast.
That fast.
Wow.
Because once it's there, that's the result. There's a minimal swelling of one day after.
So a couple of days is actually
Couple
the
of
best
days,
time to have it done.
Yes.
You heard that, Tina?
It's a lunchtime procedure, guys.
Yeah, and the Botox pala, she asked
Yes, about the Botox.
Yeah, the Botox lasts for about 3 to 6 months.
Okay.
It depends on how many units the doctor puts you.
So around 3 to 6 months, we do get back the previous ones or not as bad anymore?
Not as bad, pero some depends on the
It depends on the body.
person.
Kasi diba, Doc, some people go to like the likes of Doc Manny for Botox
Yes.
when it's a little, too late. Kasi meron na talagang lines diba,
Yes,
Doc?
that's the time you
Hindi
put
lang lines,
fillers.
talagang lubog na,
Yan.
di
Yung
ba?
mga lubog.
Yeah.
So, Botox, Doc, tama ba, Doc Manny, is parang preventative pa siya.
Botox
to go.
is it relaxes the muscles.
Yeah.
No? it's good for mga yung wrinkle lang when it's a muscle of facial expression, no? You just paralyze them for some time, and then the earlier you do it, the better, kasi
I see.
it won't form any wrinkle or sunken.
And then in 3 to 6 months time, if you see it coming back,
Go
just
to
go
the doctor.
Yeah,
go back to you.
Yes. Go to Salamat Doc.
It's kind of addicting though. Because I remember. Let me just share, Doc. We all have that one friend who loves to treat, right? And I drove her to her cosmetic surgeon, and she's like, "Oh, I'll treat you to like a lip filler." I'm like, "Oh, I've been wanting to do that," and I tried it. Oh my gosh. Doc Rylan, I swear to God, kahit wala akong rampa nung gabi, nirampa mo.
Gusto mong rumampa.
Nirampa ko sa BGC talaga yung labi. It's like my favorite procedure. I swear. Lip
Lip
fillers.
augmentation?
Lip fillers lang.
Lip
though.
fillers.
But is there augmentation for the lips?
Yeah, that's what we call it. Lip augmentation.
Okay.
You augment the lips by fillers.
By using
Lip fillers lang. Okay.
My question is, fillers lang ang pwedeng gamitin? I mean, do you have any other material, component, or it's
Fillers
just
lang.
fillers?
Fillers lang.
Fillers.
Because this is a soft membrane.
Yeah.
So you cannot put any implant there. So ang tigas naman. You cannot kiss na.
Oh yeah, I get what you mean. I get what you mean.
And Doc, please correct me if I'm wrong. It is like, when you see instant results, you kind of get so like blown away and like, too happy. Like, alam mo yun, gusto mong
And it's
ulitin agad.
addicting.
There you go.
And your
There you go.
confidence level literally shoots up.
Exactly. So,
Yes.
Doc, have you ever turned a patient down because parang hindi pa time?
Akala
Wag
ko
muna.
hindi kaya.
Like, tama na yan.
Wala na pag-asa.
Diba? Masyado na malaki, girl. Mga ganon. I mean, kasi, like, I know some people, they really get addicted to it. And I could, like I said, Doc Rylan, I understand why, because I did the same thing. But have you ever turned down a patient because you
A
just...
lot of times.
Okay.
Yeah, because, for example, I just did lip fillers. 2 months, I think it's okay pa.
Yeah.
And then
And then
they're
just because they wanna-
insist. Yeah, they keep on insisting in
Insisting.
demanding.
Oh my gosh. Like, I've been seeing pictures of Zac Efron. I'm not even sure if that's real. But
Baka it's AI.
I hope it's AI. But
Why? What happened?
he's like super, yung mukha niya, Doc, puro fillers. And I'm not sure if this is real.
I saw the picture, but I'm
Yeah,
not so sure as well.
I'll show you a picture. But again, 863108899, or you can send us messages on our socials at the Tina Ryan.
Yeah.
Doc Manny, what's your Instagram account? Doc Rylan.
A verified Doc Manny Kalayan.
There, kasi kaya verified na.
Well, yeah, I just got verified quite recently.
Good for you.
It looks like Doc Rylan in Facebook.
Nuts. Okay. What's the biggest myth about cosmetic surgery, Doc Manny, you wish people would stop believing?
They think cosmetic surgery is a magic thing. They want instant results.
I was gonna say not just because you're in Magic 89.9.
Aside from being here.
Like instant results, like
No, pag nagpa-nose lift, they want a matangos agad.
ay hindi, di ba
final
matagal
result.
gumaling yun, di ba,
Of
Doc?
course, there's swelling time.
Yeah.
3 months, 6 months. Ganyan.
So it's not because others it's like. I mean, it's like watching cartoons, like the fairy godmother, and then
Right.
snap, you're good to go, and you're to the
guys-
party.
Yung fillers
ito,
instant.
Yeah. Yeah.
Yun yung try nyo, instant yun, guys. So it's like, okay, so...
Pero any surgical procedure, of course, there's swelling.
I will agree with that. One is that you do still have to go through all of these inflammatory reactions because there is a procedure.
Yes.
Plus-
because there is a trauma.
And I think the last thing would be there's no guarantee. Because it
Of
depends
course,
it
yeah.
depends on
Because
the
the
literal structure of your
Bone
body.
structure.
May
yes.
nagdemanda ba sa'yo, Doc, nun? Like, alam mo
Wala
hindi...
pa naman.
No, like hindi bagay.
Sabi ako.
Like, ganun ba yun? Like, kunyari, Doc, like, I've never really considered anything drastic to change in my body. Like, say, if I go to you for a nose lift, do they bring a picture and say, Doc, I want to look like this?
Nako, yes.
Oh, and then you say no.
And then they bring the picture of Barbie. The Barbie doll.
Mukha ba
Kaya
silang
di ba may mga
Barbie?
Barbie
No
procedures
way.
na?
Hindi, pero bagay ba? Babagay?
Hindi nga eh.
Oh my gosh. That's a problem. But how do you tell them without offending? Na hindi bagay ito eh.
I'll do what's the best for you. What suits you, your face. Because if you put this nose into your face, it's gonna look like abnormal. Parang it's halatang halata.
Mas distorted pa than
Yes.
natural.
Okay, but have you ever like followed the patient's request and then parang, you know, after the surgery, parang talagang di bagay?
No,
Hindi
talagang
pa.
I tell them there's no guarantee. I'll do what I can do, what is best for your face talaga.
I do have one question. How can you literally describe, not perfect, but a beautiful face? I mean, how do you describe? Kasi,
oo nga.
di ba, I mean, di ba they always say that beauty is in the eye of the beholder.
Yeah.
Pero, as a cosmetic surgeon, you're the beholder.
In
How
my
would you
opinion.
describe a beautiful face?
Like peg natin na lang, like a perfect face
Yeah.
sa,
There's nothing perfect daw eh. Kaya nga-
I mean yung ano,
Mga 99%.
oo, yung, like in local show business, yung sa mukha, Doc, sino yung tingin mong tama ba, Doc Rylan? Maganda?
Yeah, I mean,
Or-
how would beauty be
He's
described?
asking,
Oo nga
how would I
eh.
describe a beauty girl? Yung parang, she looks so soft lang. Soft beauty.
Nice.
Yeah.
I love that term. Soft
beauty. Not so sharp. Parang hard face. You know, parang...
What about sharp
halata.
edges? Di ba yung jaw sharp yun?
Yung, ano daw yung may cheekbone, mga ganon.
Yeah, I think for me parang yung, the soft beauty. Parang walang ginawa pero she's pretty.
Ganun. Pag gusto ko yung ganung beauty. Walang ginawa.
Walang ginawa pero kailangan may gawin para magmukhang walang ginawa.
Hindi, no. May ginawa pero hindi halata.
Hindi halata. Oh my gosh.
pala yun.
I know.
Sige,
Okay, wait. Who's this? Oh, yeah. Off air. I'll tell you
Baka tayo madulas dito. Baka madulas.
We have cosmetic surgeon Doc Manny Kalayan with us tonight here on Healthline. If you have any questions, please give us a call or send us a message on our Viber line, which is
0945-971-4011. Kasi nga nasa likod ko, kaya nga nandito na sa harapan.
Doc, are there any procedures people get that actually help with health, like breathing or mobility?
Actually, when rhinoplasty.
Okay.
Lots of my patients have this sinusitis.
Oh.
And rhinitis, morning
Allergies,
morning
mga ganon.
allergy, and then
Yes, and I do believe that rhinoplasty right now is covered by PhilHealth as long as you can defend it. It was used because of a nasal problem.
because
If
of the
I'm not mistaken.
sinusitis,
Yeah, because previously
It's an elective
PhilHealth
case.
does not cover rhinoplasty in general. But because it has been proven that actually it does better
Oo,
for
sa
breathing,
sinus,
so
ganun.
PhilHealth actually
But they have to
covers.
undergo the physical exam from an ENT.
Oh, okay.
The eye, nose, ear,
But
nose.
at least it's covered now for
At
most
least,
of
yeah.
them.
As
Well,
long as
that's good.
it's true and
Indicated
legit,
for the
yeah.
procedure.
Indicated for the
See?
procedure.
Okay, here we go. What's one skincare rule you wish every Pinoy followed, especially with our heat and humidity, Doc?
Always wash your face.
Ooh, okay.
Wash your face at least thrice a day. That's what I do.
Thrice a day.
Because you prevent oiliness of your skin.
Ito na naman tayo, Doc Rylan, sa oiliness.
With washing, no,
Is next
I
to
will
point.
ask. But washing is just with water
no, you can
and that soap
yeah, on my
moisturizing
first
soap.
time it's with soap. And it's for the succeeding ones with just water.
Oh, just water.
Just water splash and then
Just to get oils out of your face.
dry it. Ganon.
That's
Great.
hard for women because, magpapaganda na
makeup.
naman kami.
Oh, you have this parang remove the oil that
Yung oil blotter.
Yeah, oil
Yes,
blotter,
okay.
yeah.
That's a good one to have, ladies. We hear horror stories of cheap procedures gone wrong. How can listeners protect themselves when choosing where to get a procedure done, Doc Manny?
Oh, of course. First of all, the doctor has to be a doctor, really. medical graduate, and then he has to be a member of certain societies.
There you go.
Yeah, and then you have to ask his credentials, his previous works, and all his board certifications in the wall.
There you go.
Yeah.
Okay, and then make sure, like, I don't know, maybe referred by a friend.
Referral.
Or
yeah.
you can always go for a consult first, di ba? Ay, hindi. Pero hindi, mahirap din eh. Minsan may mga nadadali din sa consultation eh.
Yeah, yun nga nadadali sa consult is the ones that are not certified.
I would presume kasi with a consult, it's like once they're done with the consult, it's not really done because then they recommend all these things afterward, di ba po?
During the consultations. If you need this, why don't you do it now? So it's a one-time procedure.
One question. When you do all of these procedures, do you mandatorily require, say, to look into the actual medical health of a person, like CP clearances or something like that?
Yes, yeah, it depends. If there's a major one, like the liposuction, the breast augmentation.
Because these are bigger surgeries.
These are under general anesthesia.
Yung tulog na tulog.
These are under,
Yes.
it is under general anesthesia, so they have to undergo medical laboratory clearance and cardiopulmonary clearance. Because with the nose, with the eyes, with the minor ones,
They're all local.
They're all local. So they're awake. So
that's
gonna
good.
be fine.
Rhino, may awake na talaga.
It's been awake.
Akala
Ever
ko
since.
tulog sila, Doc. Like,
It's
wow.
well,
It has dates. I don't know why. Siguro
I
more
will
bayad.
agree. Because the good thing with cosmetic surgery, some of the procedures are really fast. I mean, it doesn't take as long. I mean, I take hours in my surgeries. But that's the reason why, kasi yung mga kasama kong cosmetic surgeons, in between their procedures, makikichismis. Ano nang ginagawa mo? Nakaisa na ako. Mamaya, after 30 minutes, babalik. Oh, 2 na ako. Mamaya, babalik. 3 na, uuwi na ako. Dok, eto, nagmamartilyo pa ako.
Martilyo talaga.
Martilyo talaga. Sa notes yata yung martilyo na yan.
Oh my
How I
gosh.
wish.
I have to take a quick break, you guys. This is Healthline. We have Doc Manny Kalayan in the house, and also my co-host Doc Rylan Flores. We'll be back with more of your questions, actually. So please do not go anywhere.
Magic 89.9.
Tabudlo with manloloko. Manloloko, parang may hugot, diba? This is Healthline here on Magic 89.9. We have cosmetic surgeon Doc Manny Kalayan with us. Doc, what's trending now in non-surgical cosmetic procedures? Madami ba?
Non-surgical, like what I've said, the threads.
Okay, threads
The
pa
threading,
rin.
the cog threads, the aptos threads, the ul therapy,
Okay.
the Ulthera, the Miracle Light. There are lots.
I keep on hearing that Ulthera. What does it actually do?
Ganito,
Sorry,
Ulthera.
For super lift.
Ul therapy is a non-surgical facelift. Because it emits microfocused ultrasound only.
Ultrasound. Okay.
So there's a machine we use, and then there's a transducer that touches the skin, and then when it touches the skin, you hit the pulse, and then there's coming parang pitik, and that's under the dermis to tighten the skin.
So it tightens it afterwards.
But there is downtime, Doc. Tama, ilang days yung downtime?
For ultherapy, siguro mga 3 days.
Yun, oo.
So
Kasi
3 days mo nang lalabas muna.
mamumula ka ng konti. Konti lang naman.
Mamumula ka ng konti because of the pain.
Oo.
The ganun, pero no talaga, no trauma.
Wow.
Yeah. Speaking of therapy, we have a promo now.
Oh,
It's buti
No,
pinaalam.
because it's not,
Yeah.
therapy is not that cheap, diba, Doc?
Therapy is
Cheaper now.
expensive.
Yeah, oo. Especially when it first came out.
Yeah.
One area, it costs mga 80,000.
Yeah.
Wow.
But now you
For
have a
the chicks,
promo?
We have a promo from July 11 to 15.
Nice. Nice.
Oh, the
Okay.
next 5 days.
What's the promo?
Starting Friday.
The promo is 50%
Wow.
Seriously?
Wait, for
for the whole face.
For the whole face.
For the whole face.
Wow.
Di ba, paminsan parts lang kasi.
Yes,
Yun
yes.
nga eh. So ito-
May crowns, may forehead.
So this is 50 off
Yeah,
for the whole
including the
face.
double chin. If you have the sagging chin.
Oh. You know,
So you might see it. So pag nawala pala ako ng isang episode, alam mo kung ano nangyari?
Nag-pole therapy si Doc Rylan. Hi, Aperture. Thank you so much for listening. Wait, give me 1 second. May somebody from the gig sent me a message regarding the difference daw, Doc, of thread and fillers for
The nose.
The nose.
shucks. Teka lang, hanapin ko lang. Nawala!
I think for the...
Ano daw ang difference, Doc? And what do you recommend? Fillers for the nose or should they go threading?
I would suggest threading because it lasts longer. It may last up to... Mine is, di ba I told you I had it done. And then, this is third year na.
Oh, wow.
This is
But
third year na.
threading versus the actual
The
standard
rhinoplasty.
which is...
The implant?
Yes.
Actually, of course, the implant.
Still an implant.
Yeah, because
Implant
it's-
for the nose?
Yeah.
No, the regular...
The regular rhinoplasty.
Rhinoplasty, the regular nose job.
With the implant.
Oh.
Yeah.
Oh.
So that's still superior over thread.
Yes, and that's mas nire-request nila
Oh.
than that's more mabenta in the clinic.
Okay.
Ang alin, Doc? Ang filler?
implant.
The implants.
implants
Still.
na.
Ooh.
Fillers,
Hindi lang sa
fillers
ilong.
versus threads. Threads is
Threads,
better. But
because-
threads versus the rhinoplasty. Rhinoplasty is still the
implant
superior
pa
one.
rin. Yeah.
Because that lasts longer.
Yes, because the fillers they last for about 3 to 6 months only.
And they don't really like parang ini-enhance lang naman 'di ba nung fillers.
yes.
Pero pag rhinoplasty talagang mag-iiba yung features mo.
Talagang
Tama ba?
buo
Oo,
yun, yeah.
Oo. Doc, how do you heal like hormonal dermatitis on the face? Is that a thing? I get reddish bigla and I notice it's because of the dermatitis.
When you say hormonal, it's because of the hormones.
Okay.
They have to
Hi, Faye.
they have to go to an endocrinologist
Uh-huh.
to treat the imbalance.
Because it's the imbalance that actually kicks
That causes
all of the problems.
problems.
So the root cause has to be taken care of.
Yeah.
Doc, I had my first baby last year and I'm dealing with melasma. What's the safest treatment while breastfeeding? That's from Camille.
Breastfeeding, the lasers are safe.
Okay.
They can do the picotone. What's the fastest laser used for that is what we call a pico laser.
Okay.
So even if they're like breastfeeding or even if they're pregnant, they can actually do that?
Even if they're pregnant.
Wow.
Because there's no radiation.
So it's literally safe for both mom and
Yes,
baby.
yes.
Nice.
You're welcome, Faye. And go see an endo as recommended by the two
Right,
doctors here. Doc Manny, how do you wait? What's your
It's overlapping one over the other.
What's your opinion on DIY cosmetic kits being sold online? Like yung mga, how do you pronounce
Hyaluronic acid.
hyaluronic pens? What is that? Hyaluronic pens?
That's the component of a filler.
Okay, so I mean there are a lot being sold, right?
Really? I don't know. I didn't know.
Yeah.
That's a big question mark for me as well. Because I do use hyaluronic acid for joints. I do inject it in joints.
But you're a doctor.
Yeah, that's why it's a wonder that it's actually available online.
Yeah, is that true?
We gotta look into this.
Is that
I
true?
guess.
I can't believe it.
We usually have
Sent
all
the
of these.
question. Hold on, I lost her.
Yeah.
Baka it's the silicone oil.
Oh, okay.
What's the worst case you've had, Doc? Like a what's that? Botch surgery?
You mean from another?
Yeah, from a doctor.
or-
Like, were you able to help like a patient?
Salvage. How they
Actually,
work.
usually my patients came from a non-MD.
I think that's one of the big problems, right? It's not literally a botched surgery coming from another surgeon, but it's a botched surgery coming from
a non-licensed.
Non-licensed doctor.
Yeah.
Or a non-doctor. Mga esthetician, beautician, ganun lang.
Oh my gosh. Pero in the US kasi, even the estheticians, they might be, ano sila, doc, di ba? May license
pero
sila.
their training is strict din.
Oo.
And I do believe there are things that you can do as an esthetician, and there are things you cannot. And for them, because there's a license that they have to protect, they do just cover for whatever they can do.
Yes.
Unfortunately, here, I don't think we have licenses for estheticians. Right? So they can literally do anything that they can feel that they're confident enough in doing, but in reality, they don't have the training for it.
Our estheticians here came from, usually they trained from Singapore. They have the crash course of aesthetics.
But if you guys have PAMI, like, yung mga organizations na, like that, I mean, can't medical doctors like you guys form like a group for the estheticians so they can be properly trained and licensed? Tama ba yan?
It's a big question mark because these medical organizations, PAMI is one of them, is a medical organization. So literally, it depends if they do accept like affiliates or non-doctors in their organization for one reason or another. But the problem is we cannot run after botched procedures simply because there's no license of the
there's no
the aesthetic esthetician. There's nothing holding them to their jobs. So
because
we can't run after
there's no
them.
borderline, no? There's no restrictions.
So we can't literally run after it. It's different if a doctor does, if there's a problem with it. We have licenses that we need to protect. So because somebody can just simply run after these licenses. For estheticians, they don't have that license.
Kaya
That's a problem.
So parang like, as I mean,
No,
like,
they even say they are doctors, diba?
Unfortunately, there are some.
the usual,
They wear white coats and call themselves doctors as well. Unfortunately, yes, we've heard of some of them.
so sa samahan nyo, hindi kayo pwede magtayo ng organization for them to know, like.
I know.
It's
Lalo na in surgery,
it's a
no?
trivial
I mean,
thing.
estheticians are not gonna ever
It's a very, very-
do surgery though. Pero yung mga,
I think it's a very, very trivial thing because one, you have not just anyone can build it. It has to be under supervision, which means that the government has to come into play. The PRC has to come into play. So it's kind of when
The Department
government
of
comes
Health,
into play,
Yeah.
you now have to deal with Congress, the Senate, and all of these things. It becomes law. So it's not an easy task to do that, even if we want to.
It's not a short time.
Exactly.
It's gonna take years.
So it's literally
let's start
a
lobbying
difficult
for the
thing.
estheticians. I'm 38 and starting to see lines around my eyes. Is it too early for Botox from Rina?
No,
Antipolo?
no.
Okay.
You're 38. You're just in time.
Yeah, you said 24, 25, right?
What's your youngest patient, Doc, na nagpa-Botox?
Botox, mga 25 nga.
Okay,
26 ganun.
25. Oh, wow.
For the rhinoplasty, I had 13 years old.
13. I
Of
would
course
presume.
not.
Really? Wow.
Yeah.
I mean,
That's a girl. Because after nagka-mens siya, you can do a rhino na eh.
Oh, so once the
Cycle
secondary
starts.
growth spurt starts
Starts
already,
already.
pwede na.
Yes.
I mean, what kind of convincing did she have to do, diba?
Because the growth of the
parents.
nose, the nose nasal bone stops already. During the
Okay, was it just for cosmetic? I mean, for ano lang, like
Cosmetic reasons.
For rhino.
For
pampaganda lang or meron siyang health?
Pampaganda lang.
Wow, buti pinayagan ng
may
mom.
Because
consento ng mom, I would presume.
Yung mami pa ang ano.
Oh my gosh! Okay.
Mami pa ang excited kaysa sa anak.
Oh, wow.
Because her daughter though is going to high school. So she wants her daughter to
Look pretty.
Feel confident.
pretty.
And with
With the start of the year, the first year. So, ayaw niya ng chismis in the long run na, uy, retokada yan. Hindi naman maganda yan ng first year. Kumanda bigla ng second year.
So even before high school started,
Yes.
game, let's go. Let's do this.
Oh my goodness. Doc Manny, can you recommend a good sunblock for oily skin? This is coming from a guy. Everything I've tried makes me look greasy. From Paolo from Viber. Ay, ikaw, anong doc sunblock mo?
Me, wala
Formulation mo?
talaga.
Wow!
Alam mo, I'm tamad in applying mga ganyan-ganyan. Except for the night creams.
Yeah. Okay.
Pero for the sunblock, use the powder one. The powdered ones.
Wow, okay. Powdered sunblock. Okay,
Powdered
sige.
sunblock.
What about your comments on oral sunblock?
Oral sunblock, I'm not sure of that yet.
Oh, ano?
Pero,
I do take it kasi.
you mean to say the gluta?
No. Oral sunblock.
Like a pill form?
So
In a
what,
pill form.
Shut
what's
up,
the ingredient?
Doc.
What's the main ingredient?
Let me check on it.
Let's, yeah. What's a generic
Let
name?
me know
Tell us.
first.
I will. Let's talk about it.
Doc Manny, if you could use one skincare product for the rest of your life, what would it be from Kim?
Of course, from the Kalayan Clinic. No, kidding aside. It depends on your, if you're young to it, then you can use it as long as you're alive. As long as you're happy with the result. Kasi there are products which makes you, parang rebounds. Rebound, what do you call this? Rebound hyperpigmentation.
Oh.
Yung super like mamumula, ganun?
Nangingitim.
Baliktad pa.
Okay.
Susunog.
Oh, okay. Wow. Oh, wow.
If that does happen, are there any remedies for it?
Lasers.
Lasers.
Yeah, but it takes sessions ang laser. So it's not a one-time
Not just a
thing.
one-time thing.
Hold on,
One time.
I'm checking the phone. Hi. Oh, okay. I saw it ringing, but I caught it last minute. Doc, somebody's asking for a friend.
Yan na naman tayo sa asking for a friend. Ayaw pa kasing aminin.
Millionaire.
Will her future boob job, she's considering, but she has back problems. And I told her I almost did it, and I kind of backed off. But coming from a cosmetic surgeon, is it a good idea to get a
What's
boob
the
job?
cause of the back problem?
she just says
Yeah,
she has a back.
I was
I'm
gonna
not
ask
sure if you
about
have
it.
spondy like me.
I was gonna ask about it as well.
Depends eh. If it comes from the spine,
Then no matter how much boob job you do.
Sasakit talaga.
Sasakit talaga.
Oh, okay.
if it comes from the scapular area, might as well not do it.
But it's true that if you do have large breasts and that is the reason for your back pain, you can
Nakakadagdag ba, Doc?
Yes.
Okay, Doc, please.
I reduce breasts that are too huge.
because for their frame, right? They're not that
Well,
tall.
that's-
cut down, so
Never
they make
had
them
that problem.
kuba. It makes them kuba, and then
And that gives you the strain because you kind of
Yes.
slouch over.
Yes.
Yeah.
So is it just as painful as a breast augmentation, Doc?
Which one? The
A
reduction?
reduction?
same thing.
It's still a surgical procedure, right?
Yes, but the reduction is more tedious than.
Parang feeling ko mas masakit, Doc. Kasi diba,
because you remove
babawasan.
remove some parts of the
unlike
gland.
if you
Unlike
augment,
if you augment, just put and then
that's
you
it.
just
Yeah.
open and then put make a pouch and then put and then close.
so it's
what are
easier
the
to do
Augmentation.
to augment than to
That's why the reduction is more expensive.
Doc, anong klase yan ulit? Like the what do you call that? For the
breasts.
breast augmentation, it's
What you use
saline.
for
Tama?
Saline.
Oh.
Saline is wala na.
Wala na. So what do we have now?
Nag-ano lang siya, nag-leak.
Ooh.
Because it's a silicone gel pouch and then you put in saline water.
Depending on the size that you
Depending on
want.
the size that you want.
Okay.
Whereas the silicone gel, that's still the most popular and the most
That's what I
safe.
actually see in the market.
Until now, wala pang bago, Doc. Yun pa rin.
Yun pa rin.
Okay.
Yun pa rin.
The silicone gel pa din.
Silicone gel pa rin, the standard.
They look
Pero
like
before, they
look like huge gummy bears.
Oh, I
literally.
Like you're saying, Doc, before?
Before they are using the smooth texture.
Oh,
Now we use how they call this non-smooth, yung parang textured na.
Why texture?
Para magaspang.
Is it because of...
It's inside.
What do you call this? It prevents contracture
Oh, okay. That's a good thought.
rather than the smooth.
The smooth one.
According to our studies and experience.
Oh, okay.
Okay. So to this day, Doc, nakailan ka na? How many breast augmentation have you done since you
Way
started?
back. No,
So you can do it with your eyes closed. Gian Sky, Doc, this was discussed earlier, but are Hyphu and Althera the same po? What's cheaper and what's best for acne-prone skin? Asking for a friend. And again, speaking of Althera, they have a promo, 50% off.
Yes, July 11 to 15.
11 to 15 this month, and all clinics.
All clinics, yeah.
Okay.
Just visit our website at mannyandpaikalayanclinic.com.
Aw, there you go, Gian. Is it true? Ayan, Doc, ano daw nga ba ang difference? And ano daw ang better for acne-prone skin? Hyphu and Althera, are they the same?
Hyphu and Ulthera, they are the same, but the Ulthera is the, what do you call this? Is the legitimate one. Because they are the ones who invented this.
Oh.
The Hyphu
So like
are
they're the
just
pioneers for
yeah.
Okay. So, how do I...
That's the what do you call this? The clinics who are who has Ultherapy are what do you call this? Parang sikat na clinic. Parang what do you call this?
Yeah.
The legitimate clinic.
Yeah.
Like his clinic.
like,
You say that.
Well, I'm saying it.
okay.
Because they cater to doctors only. Whereas the Hyphu, you can find it in a skin center with
like-
just an,
everywhere.
with just a businesswoman who owns it. Parang ganun.
Okay.
Oh.
So sa Ultherapy pala, ang doktor ang gumagawa talaga.
Yes. You cannot delegate it to your facialist or
There you go, Gian. Okay, so obviously,
That's good to know.
Ulthera is a more expensive one, and again, from July 11 to 15.
15.
Oh, 50%
You can deposit now or pay now. You can have it done on the 15th and the
Look at that. Look at that. Faye, again, Doc, is it true that you can't use a skincare product for a prolonged period of time? Nawawala daw effect ng product on your skin?
What product? It depends on what product. Is it for
Okay.
peeling skin, for peeling solution,
But
or
somebody did tell me na parang she switches every two weeks. Yung ano niya, moisturizer niya. I don't know if that, I mean, you...
Well, I'm no dermatologist,
I know,
nor am I
like-
cosmetic surgeon. So, my mind's
here
baffled.
I'm more of cosmetic surgeon.
Yan, so Faye, ayan. Hi, docs. Ayan, thank you daw, Doc. You're welcome,
You're
Gian.
welcome.
Gian Sky. Okay, here we go. Again, Doc, how can we find you? Like, where are your clinics again?
Yeah, my clinics are located at Medical Plaza Makati and at Festival Mall Alabang. Anyway, you visit our website na lang. That's just to be easy, no? www.mannyandpaikalayanclinic.com, or they can go to my socials.
There you go.
Doc Manny Kalayan. Basta type Doc Manny Kalayan, ako yun. Basta meron akong picture ko.
Try to Google it. Try to Google it. It's gonna come out.
Or Google the Manny and Paikalayan Clinic. Yeah,
What's the
will come up.
craziest beauty request you've ever gotten from Jason asking?
Crazy?
Like,
Like,
I think the 13-year-old's crazy. Like a crazy request. 13.
No, and my craziest one is, for example, I want to look like, who's the singer?
Okay, now I'm curious.
Oo nga eh. Local?
No,
International?
international.
Taylor
International?
Taylor Swift.
Okay,
Because
wow.
she's a Swiftie.
Oh.
So she wants to look
She
like...
wants to look like Taylor Swift. Oh my God. Sabi ko, first of all, you're a Pinoy.
I was gonna say...
How morena ba yung person?
Morena.
Not just Morena. I was gonna ask, at least the features. How close or far was it from Taylor Swift's looks?
So how do you tell them without offending them that it's kind of impossible?
No, I tell them straight. No, I cannot do that. Because first, you're Filipina. Swiftie is a puti.
Yeah.
And then secondly, yung skin tone mo is different from Swiftie. And then sabi sa akin, ba't si Michael Jackson po?
Okay.
But
okay.
what did Michael Jackson take? Like,
He had vitiligo. He had the disease.
It's a disease wherein the
Yeah.
melanin of
I
your
know what
skin is
vitiligo is.
gone.
And then it's
So it spreads. When you get older, it actually spreads.
How did I not know that? Oh my gosh. I'm ashamed for myself. Okay.
Yeah.
Wow.
Kaya sabi nila, anong treatment ba yun? No, that's vitiligo.
Oh my goodness.
Baliktad, may sakit siya.
Baliktad, may sakit siya.
Doc, we have one last question from Alex. Have you ever had a client regret a procedure? And how did you handle that?
What do you regret? Na pinagawa niya to?
Pinagawa niya, tapos hindi siya na... ano ba? Paano? Oh,
No, it's not them. It's their parents.
Oh.
Of course, di ba, for example, pero he's ano na, he's legally
Beyond 20 years old already.
Beyond 18.
Beyond 8. Oh,
So 18 pwede na?
Pwede na.
Okay.
no consent needed.
And then she looks so pretty, so
But-
beautiful, but the parents are conservative. They want to take it out.
Oh my gosh.
Put the old one.
Oh.
Old
Black.
what? Old nose?
No, the old look
Old look. Can you even...
of the
Oh my
daughter.
gosh.
Sabi
Can
ko,
you even...
why naman your parents like that? Di ba? They're not supportive.
wait, mamare-reverse pa ba
Old school.
yun?
No, you just remove the implant. Ganun
Oh
lang.
my gosh.
But did you eventually do that or no naman? Convince the parents otherwise?
I had removed twice.
Oh.
And then most of them, I convinced the parents or
So-
the jowa.
So it's not a problem because there were complications or otherwise, but it's because of acceptance
Yeah.
from
Yeah.
whoever's close to them, like parents or
Yeah.
spouses or otherwise.
So I'm sure there are a few listeners out there aspiring to be a doctor, whether
I'm just a carpenter.
Ortho.
an ortho or a cosmetic. I mean, like, why cosmetic surgery?
Because I don't like emergency cases. I don't like morbidity and mortality.
Okay.
Yeah, I want,
Gusto mo na magpaganda.
Gusto ko gumanda sila. I want them to look, feel happy, look pretty, ganun lang.
What is your message to aspiring cosmetic surgeons out there?
You have to be determined talaga. First of all, the medicine course is hard and long and expensive.
True.
Yeah, just devote your time to study and then dapat ang pinapasukan mo yung talagang gusto mong line.
I would
Tulad
agree.
ito, nag-cosmetic, hindi tinuloy.
Oo nga, Doc Rylan.
No, hindi lang sa hindi tinuloy. When I was in med school, we still have a few minutes, I really wanted to be a cosmetic surgeon. I mean, all throughout.
Yeah.
And by the time I went into clerkship,
Sayang, oh.
I literally even hated orthopedic surgeon. I mean, surgery. Because 2 weeks orthopedic surgery, I only did 2 things. It's either I clean foot or I cut it out. For 2
that's
weeks.
right.
That was all I knew about orthopedic surgery. I go, bakit specialty to? Until when I reached my internship. First day, May 1, duty, surgery. Orthopedic case, total joint replacement.
Oh,
and I see
God.
this
Oh, my.
and I see this consultant of mine, this attending of mine, one power saw on the other hand, one power drill in that. I go,
Oh my God,
shoot,
I do like that.
macho.
that sounds so painful.
I did it. But eventually I did train for cosmetic surgery. I was in there for several months with Dr. Jose, who just recently passed. So may God, may rest her soul. So
See?
yes,
Oh, you heard it
Just now.
You heard it here first, Doc. Oh my God.
Yeah,
July
she's
7th.
our boss.
Oh my.
I'll talk to you later about it.
Oh my God. Off air.
But,
Okay. So
yeah.
May rest
But
in peace, Mama.
she literally courted me for the entire 4 years of my training in orthopedic surgery, just so as, hindi ka bagay dyan, dito ka sa akin. So I did, several months of training until, for one reason or another,
3 months every day? 3 months, yes. Yeah, because
But I wasn't there as a regular fellow. I was more like I did my practice and then half-time parang ganun in arrange for me.
Yeah.
So I was still an orthopedic surgeon. But for this one particular week, all of a sudden, parang something was guiding me na, hindi, mag-ortho ka. So at the end of the week, I was literally beside her, seated or more like kneeling, and just saying, Doctora, sorry, I think I will just be contented to be your orthopedic surgeon. So
What'd you
that's
say?
my story. But what's good was whatever I learned, especially for wound healing, how to close wounds and all of these things,
Right.
I do apply for my surgeries in orthopedics.
Yeah.
That's why
In a
sometimes
cosmetic way, no? May
the cosmetic way.
natutunan ka.
So I'd want to believe that my wounds end up nicer than
Yeah,
if it were just
cosmetically
regularly
nice.
done.
than the GS1s.
No, Cohen and
And Doc, do you ever plan on maybe trying something else besides cosmetic surgery? Did it ever cross your mind? Oh, I'm going to change, maybe try something else. I mean, still in the medical field.
Yeah,
you know.
yeah. I'm in the medical field, pero I put up a coffee shop.
What?
whoa, we gotta go there. Where's this and where's this?
Yeah, it's
I didn't know you're such a coffee lover.
coffee. I call it Cafe Kalayan.
Oh wow!
And then,
Ano yun? Pwedeng
Congratulations.
lunchtime procedures? Diba? Magkakape lang ako,
Let's have
guys.
coffee.
Kasi Botox na ako. Paglabas ko, maganda na yung lips ko.
Hindi, I'm planning to put up a parang gluta frap.
Oh,
Gluta frap.
seriously?
Placenta, lava.
Wow, like so
We gotta check that coffee shop.
Collagen latte.
No, but right now it's just coffee talaga.
Yeah, that was just coffee.
Aww, where is it?
It's gonna be along Timog corner. No. E. Rodriguez corner Morato.
Really? I'm near that area.
Yes.
So
I'm
it's
near
open
that
na.
area.
It's open na.
No, we just transferred to this new building. Pero we were
Okay.
before in Tomas Morato building. And I have one in Lucena in our place.
Wow, Lucena. Oh,
I
Lucena.
look forward to that. I'll go there.
Lucena,
Doc
I'm from Lucena.
Doc Manny
Quezon.
told me to come here.
Quezon, yeah.
Wait, see, Lucena. Chris Chuper is a counselor in Lucena.
Oh,
Yeah,
yes.
Love
Yeah.
Radio. Nicole's
Yes,
partner.
yes,
Yeah,
yes.
that's why he said goodbye muna sa radio. Oo, because he ran. Oo. Hi, Chris.
As a konsehal?
Uh-huh.
Really?
Let me confirm, but I know it's from Lucena.
Sige, visit my coffee shop.
I'll message him now. Anything else you wanna add or you wanna say hi to, Doc, before we let you go? Because
Yes,
wow,
yeah.
time flew
I
by.
know. It's 8 o'clock
Going
already.
to the promo. We also have the promo for rhinoplasty and blepharoplasty.
What is what?
The rhinoplasty is the nose lift.
What's the other one?
The blepharoplasty, the deep set eyes.
Left-
If you have
Blepharoplasty.
blepharoplasty.
Oh, yung mga nagdo-droop na yung.
Yung nagdo-drop yung eyes, may eye bags. Yan.
Oh.
Yan, it starts from 50,000. Before it's mga 100. Ngayon, the rhino is 47.5.
So-
Regular is 100.
Diba? So
That's
affordable
a July promo.
nowadays.
July promo.
July
July
promo.
11 to 15.
No, the surgery is the whole of July.
Oh, but they have to.
The
Ultera.
is the 17, 15 to 17 lang.
Great.
And thank you so much, Doc. I do hope
Thanks
you can come
for
back
inviting
here.
me, yes.
You're more than welcome. Pares pa kayong lasalista, diba?
Yeah,
Animo.
And that is it for Healthline. Tina Ryan saying bye. See you next week. Doc Rylan.
Yeah, always tune in for any health problems and queries. We're always here every Wednesday, 6 o'clock to 8. A Healthline with Tina Ryan and Doc Rylan here at Magic 89.9.
Nice.
And again, thank you so much, Doc Align, for joining
Welcome,
us. We'll
welcome.
see you
It's my privilege.
very, very soon. Good night, guys. Hang on
Yes,
tight for the
good
boys.
night.
Magic 89.9.